Hi, and welcome to Vital Vibes, episode 7. I'm Dr. Kelly Coble. I'm here with my husband, Ian Coble.
Hi there.
And today we're going to be talking about one of the most controversial subjects in dentistry.
And what would that be?
Root canals.
Okay. Bring it.
But before we start, we need to go through a disclaimer. I am a licensed dental practitioner in the state of Washington, but none of this should be construed as medical advice or dental advice. This is purely for informational purposes only. And all of the information here is just my personal opinion and personal information.
Wonderful.
It's for information only.
Okay. We got the cover your ass statement out of the way.
Awesome.
What's been going on before we dive into the meat of the podcast?
It's been such a good week.
Yeah.
We took our team to this really fun vacation. We went to Leavenworth, Washington.
If you don't live in Washington, Leavenworth is this tiny little Bavarian village. It looks like a Hansel Gretel place up in the North Cascades at the base of the Enchantments.
It's honestly the most beautiful place. The Enchantments, we went there for my birthday a couple years ago.
Yeah.
It's the most beautiful place.
Oh, it's stunning. Yeah.
We hiked up on my birthday, and if you only want to go for the day, you don't need to get into the lottery. So they have a lottery for like people who want to camp overnight. It's very hard to actually win.
I've never won.
We've never won.
Yeah, exactly.
But if
you want to stay the night, it's a very difficult endeavor.
Yeah.
It is a lottery. Yeah.
But we did hike up for my birthday, and we did stay, spend the day at the lake, a very cold lake.
Yes. That was a past year. This, we're talking about current year.
Yeah. So this was a couple years ago. I just get excited about it because I love the Enchantments. But no, this year we just went to Leavenworth.
We took the team from the dental practice with us.
Yes.
Every year we try and do a reward for all the employees
Yes.
who've been with us for the previous year, just as a thank you,
As a thank you, we went to a beautiful spa hotel, saltwater pool. It was 90 to 95 degrees every day.
Weather was gorgeous. Yeah.
I got so many photons. I got a tan.
Yep, you did. It's called the Post Hotel. If you've never been,
Yeah.
highly, highly recommend it. They've got a wonderful spa in the downstairs. Like you said, saltwater pool. They've got 3 saunas, 3 steam rooms, 2 cold plunges, and just all the hydrotherapy stuff that is so cool. I think, the whole team ended up spending just like hours there every day.
Yeah.
You'd like go get breakfast and go sauna, and then you'd go get lunch, and then you'd go skiing room, and just sort of this cycle.
I mean, there were days we went to the sauna like 4 times.
Mhm.
And I'm always cognizant of how many times should women go before it becomes a stress response. But
Yeah.
I just listened to my own body. And there was one day where I became so exhausted, I had to go take a nap, a long nap. And I'm like, that's
at that level.
too much. So I was able to just gauge it off of my own response.
Mm-hmm. Yeah.
But for the most part, sauna,
Very
cold
awesome.
plunge. I was able to stay in the cold plunge much longer. I'm building my cold tolerance.
Your
Because
cold tolerance when you first started was very, very
Poor.
Like you'd get to your ankles and be like, that's enough.
Yeah.
Yeah. And now I think you're up to your waist.
I'm up to my waist. I can stand for 3-4 minutes. It's pretty dang cold.
Yeah.
But I'm building that cold tolerance. That's so important when you live in the northern hemisphere. If you don't have the sun, then you need the cold plunge.
And why is that?
It's a mitochondrial issue,
Okay.
which we can go into later. But today I want to talk about root canals. So I
Do
don't
you want to mention anything else about what was going on with the week before we dive into root canals?
Sure.
I know there was one other important thing that you were really excited about as well that sort of leads into a separate episode. The house testing of EMFs.
The biological engineer that we had come to our home.
Yeah.
How could I forget?
That's why I wanted to derail the conversation before we got too far.
So for those of you who don't know what a biological engineer is, we had a gentleman come to our home to assess the safety of our home as far as electrical wiring, EMF, magnetic flux, all the things that would affect your environment and affect your health from the outside.
Mm-hmm.
So I hired him to come and evaluate our home here, and that was pretty awesome. He had some like super quick answers for us.
Yeah, and we've even talked about it in a previous podcast.
Yeah,
We have like the little
the
EMF
detector.
detector that we've linked. I think it was like episode 2 or
Mhm.
episode 3, and this was sort of that, except from a scientist's
Mhm.
perspective, with much more sensitive tools and much more like electrical knowledge. And
Yes.
yeah,
But he
so
liked our meter. Whoops.
yeah, he said it was great for travel.
He said it was great for travel. He had some suggestions on even better meters,
Hmm.
but he thoroughly evaluated our home. He had some instant fixes.
Yep.
He had some long-term fixes, but we're definitely going to have him on the podcast in a
Yeah,
couple
that will be
episodes.
either next episode or
Mhm.
within the next 2 or 3 episodes. He's
Yeah.
agreed to be on the podcast, so he'll be one of our first guests, and he can go into it in a lot more detail than
Yeah.
I or Kelly can, about what work he does, and we can use our home as sort of a case study even.
Yeah, it was super cool.
Yeah, very much so.
Is exactly what I thought it was going to be. Like, I feel like you may or may not already understand where you're at with your home. But
Possibly.
I I think most people, if they stop and think about their environment, they have a pretty good read on it.
Hmm.
At least what he came back with was exactly what I thought.
Yeah.
But having that confirmation and then having him make the simple adjustments
Yeah.
that I didn't know how to do was awesome.
The only thing that really shocked me was just the
My son.
bye
He's
Jack.
bye, Jack.
I was the most shocked by the router, the wireless router that's
Yeah.
attached to our Starlink. That was very surprising to me.
Yeah, I was surprised too. Like we sit in this office. We just had Starlink put in here
6 months ago.
because
Yeah.
we don't have any other options where we live. We live in the country. And I didn't want to do it
Mhm.
actually because of a lot of reasons that we can talk about later. But we also need to have internet at this home. And they put the router in this office,
Mhm.
which all of my routers before have been in the what we call the cat litter room,
In the basement. Yeah.
which is the basement. And this router needs to go in the basement ASAP.
Mhm.
Um, but what he did essentially was he measured it and was like, this is toxic as hell.
Yeah.
And he put foil over it, and we were able to remeasure it and instantly had a huge
It dropped
reduction.
it like 1,000-fold
Yeah.
by wrapping it in a few layers of foil.
But the router needs to go to the basement.
Yep.
And if we have to have Starlink, there's going to be some concessions that I have to make,
Yeah.
that we all have to make. And we can talk about that on his podcast.
Sure.
But today I just want to talk about root canals.
So yeah, sorry.
No, that's awesome.
Back into the episode, no problem. Okay, root canals.
Yeah, I mean,
Super controversial.
super
I think
controversial.
even in our practice over the years, we've ebbed and flowed. So let's go.
Well, there was just a Netflix show that was removed from Netflix because it was so controversial.
Root cause.
Root cause
Yeah.
about root canals. And I actually enjoyed that podcast for what it was.
Mhm.
It was one person's journey.
Mhm.
So I think we need to like draw a line in the sand and say that one person's journey isn't every person's journey.
Oh yeah.
And I understand why it was pulled, because it was one person's journey that may not apply to like the masses.
Sure. Well, before we even go there, we're talking about root canals.
Yeah.
From a dentist's perspective, what is a root canal? Start at the very beginning.
We're going to start at the beginning.
Okay.
But every day I get asked if root canals are safe. And I even get asked like bigger questions like, do root canals cause cancer?
Mhm.
And I get asked by oncologists to take out root canals regularly. So I don't want to be sensational, and I want people to ask better questions. But before we dive into root canals and you're like, what are root canals? What are root canals?
Oh,
I want to start this podcast like I start every podcast, and we have to talk about life first.
okay.
So that's just the way these podcasts are. We're going to talk about the big missing piece. Like, so, and I don't think we can talk about root canals without addressing this first.
Okay. Well, fire.
So we have molecular medicine. That's the medicine that we live by day to day. That is what we call Western medicine. And the thing that's missing with Western medicine is the physics side of how our body actually works. Like every heartbeat we have, every thought, every immune response, it all depends on electrical gradients across our cells.
Okay.
So it's not only biochemistry, but our body is electrochemistry. So we can't talk about root canals without talking about light.
Okay.
Once again. So I want to combine like the physics research and the role of bioelectric signals in tissue repair. And then I also wanted to talk about the position of the IAOMT.
What is that?
So, good question. That's the International Academy of Oral Medicine and Toxicology.
Okay.
So, they're basically the dentists within dentistry who are into like biological health.
Okay.
So, I want to take some of the papers that have come out recently from that branch of dentistry. I want to combine it with the physics that I think is true and the established like oral medicine community. And I want to combine it all into like, okay, this is what we need to talk about.
Okay.
Biologically, like your teeth are living organs.
Mm-hmm. Each tooth is its own living organ.
Yes.
Yeah.
And it has a blood supply, a nerve supply, it filters, it has an immune system. And when that system is disrupted, we should ask how the body responds.
Mm-hmm. There's an electrical current that goes through each tooth as well, right? Yeah.
We shouldn't just be asking if the pain goes away.
Yeah.
So if you've ever had a root canal, you know that before you have a root canal, there can be pain.
Okay.
So traditional dentistry has always been like, well, the pain went away, so the problem got solved. But I want to look at it completely differently. So in my biological practice, healing requires energy.
Okay.
So some clinicians, including there's a Dr. Jerry Tennant, he describes this as using a cell voltage model.
Okay, you're going to have to explain that a little bit.
It offers one thing, it offers a way of thinking about why injured tissues struggle to regenerate if you have inflammation. So whether you describe it as a redox potential, mitochondrial function, or bioelectric signaling, healthy tissues need energy to repair.
Okay.
And this idea kind of connects to what the IAOMT, their last review paper on root canals, says. The paper summarizes research showing that bacteria may persist within the complex anatomy of a root canal, and that chronic infection can sometimes remain even when the tooth feels like it doesn't have pain.
Okay.
So, traditional dentistry has said tooth doesn't have pain, things are great. The IAOMT says tooth doesn't have pain, there might still be problems.
Okay.
All the mitochondriacs in the world understand that repairing takes energy and things might not be okay. So I want to explore like, are things okay or are things not okay when the tooth feels comfortable?
Okay.
So that's the basics.
Okay.
So like every other organ in the body, if that organ did not have a blood supply, did not have a nerve supply, we would consider that organ as
dead.
And we would remove it.
Mm-hmm.
But for some reason, inside the mouth, when the organ does not have a blood supply, does not have a vital nerve, we keep it.
Mm-hmm.
We're like, you know what? We're gonna.
Why in the past? I mean, science continues to evolve, but when originally a root canal was first invented, there was a reason. Why would we have kept a tooth that was a dead organ in the mouth from, a previous state of maybe not knowing as much, but like obviously we kept it for what we thought was the right idea.
Well, a couple reasons. Like, first of all, it holds space.
Okay.
And a root canal tooth can still chew. So now we can get into like what a root canal is, like you were asking earlier.
Please.
So when you have a root canal, the tooth is opened up at the top part, the biting surface.
Okay.
Usually.
The occlusal surface.
The occlusal surface. And the entire nerve, blood supply, ligament, everything is removed from that tooth to get rid of the pain, because the nerve is where the pain is like coming from.
Okay.
Your tooth is telling you like there's something wrong.
So if you remove the nervous system of the tooth, essentially.
Yeah.
You know,
it's almost like if you had pain in your hand and you were just like,
rip all the nerves
I'm going to rip all the nerves out. Are you still going to have pain?
No.
No. But does that mean everything's okay?
Sure.
So with teeth, we've often removed the nerve, the blood supply, and then filled it with a rubber material.
Okay.
And because the pain mostly went away, we assumed it was okay.
Sure.
And honestly, in my practice, it's mostly.
Oh, okay.
So patients will be like, when I push on the tooth, I feel something. When I run my Sonicare on the tooth, I feel something.
Sorry, I'm just laughing because we get some of the funniest things.
When I jump up and down.
Exactly. If I like hit myself in the mouth with my fist, like I get a toothache right there. And it's just like, why are you hitting yourself in the mouth?
Yeah.
Stop doing that, and I think your problem will solve.
So true.
Sorry that this is a little bit off topic, but it made me laugh. So yeah, the patients will still experience low level discomfort then.
Low level discomfort. Like when I tap on root canal teeth, they'll say there's just something different.
Yeah.
As when I tap on a normal tooth.
And that's with this, like the Explorer with like the back of the mirror.
With the back of the mirror, with my finger, whatever. It's like something is not the same.
Percussion, right?
Percussion
sensitivity. Okay.
So if every other organ loses its blood supply, it's considered dead.
Dead.
Like a Disney princess.
I think that was Olaf.
Yeah.
Olaf. From Frozen, for those that don't have kids.
But if you think about teeth, they're not just a rock. They're not just a white rock. They're actually a living cell. They have immune cells. They have connective tissue. And what else have we learned about teeth in my other podcast episodes? They're crystalline structures. So crystalline structures, what do we know about those? They're semiconductors. So teeth are semiconductors.
They're transmitting information back to the rest of the body.
Yes. So when I looked at the IAOMT paper, they basically began the whole debate by saying, what happens after that living system is changed or interrupted? So the tooth is now dead. Now what happens?
We've interrupted it with the root canal.
Yes.
Okay. Now what?
So every healthy tooth is connected to the rest of your body through blood vessels, ligaments, and the nervous system.
And the electromagnetic.
And the electromagnetic flux. Yeah.
Thank you.
So every second nutrients arrive, waste products leave. Hi, Leia.
Sorry, we have a cat. She's making her guest appearance. You hold like Simba.
She's come up. Yeah. You join the podcast.
Presence.
She's going back down.
There she goes.
Immune cells patrol the teeth for microbes, and special cells help maintain dentin from the inside out.
Okay.
So, yeah, there she goes. So dentin, let's talk about dentin for a minute, because that's the layer below your enamel. Dentin is made up of hydroxyapatite.
Okay.
Hydroxyapatite is semiconductor. Dentin is filled with fluid, filled with water. And basically, dentin is the semiconductor in the tooth. It's not solid.
Okay.
So if you look at dentin, if you look at like every square millimeter of dentin, there are thousands of tubes inside the dentin.
Okay.
And that's what the endodontists, those are the specialists who are trying to do root canals, they're cleaning out those tubules. So you cannot expect an endodontist to clean out like 27,000 tubules. They are looking at the main tubules in the dentin, in the tooth, and they're cleaning out anywhere from 1 to 5 tubes.
Okay.
So they take an instrument down the tooth, they go in through a hole in the, biting surface of the tooth. They rotary instrument into the tooth like a roto-rooter.
Okay.
They clean out like the big nerve tissue. It
So
looks like
essentially a plumber.
yes.
Okay. So
They're cleaning out the nerve.
mhm.
They pull out the nerve. They have an aha moment where they're like, I got it.
Yep.
And then they flood the tooth with bleach.
Mhm.
And then they fill the gap that they've left at
Where
the
that nerve
tooth
used to
where the
be.
nerve used to live
Okay.
with rubber.
Okay.
They plug it. And cleaning that main canal is only part of the challenge because there are thousands of canals in the tooth.
Sure. I think you
So
said like miles or something.
miles.
Yeah.
So the assumption has always been like we pour bleach in the tooth and it's going to travel down all the little side canals and it's going to kill everything in the side canals.
Mm-hmm.
Only it doesn't.
Yeah.
So that's the interesting part. So dentin is mostly collagen and bleach is highly proteolytic. So it aggressively breaks down and dissolves collagen.
Okay.
And collagen is basically corroded at this point. That's our semiconductor. The dentin is our semiconductor. And
the bleach is eating that away.
You've now corroded the semiconductor.
Okay.
So thousands of microscopic tunnels from the center of the tooth that allow fluid and communication throughout the tooth and the body is now disrupted by the bleach and the mechanical debridement of the root canal.
Mm-hmm.
So that communication is now arrested.
Okay.
So
and there's no blood supply anymore.
No more blood supply. And now what's left in the tooth is tissue that the bleach didn't find.
Okay.
And that's usually bacteria that don't use oxygen.
Mm-hmm.
So anaerobic bacteria can live in there. Parasites can live in there. We've seen other things live inside of there, like fungus.
Yeah, yeast. I think. Yeah.
Bleach doesn't kill spores and it doesn't kill parasites.
Okay.
So we don't know exactly what's left inside the tooth after a root canal, but we know things are left.
Mm-hmm.
And bacteria don't live alone. They form colonies with other things. They form biofilms and they can be very difficult to disrupt with just bleach alone.
Okay.
So if you look at let's say you were talking about plumbing.
Yeah, I feel like that's a really common analogy that we always resort back to, but at the same time, I do feel like there's a little overlap with the plumbing community just on a macroscopic level or microscopic level and versus plumbing, which is the macroscopic level.
So if you had like all the plumbing in your house, but pretend like you put for every millimeter of plumbing, you put 1,000 side channels.
Mm-hmm.
Imagine trying to clean out that hairball
coming out of your shower. So your shower, instead of having one drain, had 1,000 drains.
Yes.
You have like 5 primary drains, but then 9,996 small drains that also went off of it. They're still going to have parts of soap scum and hairballs and everything else that is the problem. But there's no way you're going to clear out all.
There's no way.
Yeah.
And not to mention that our bodies are super complex. There's tons of microbes living in harmony together. They are going to form colonies of bacteria, parasites, yeast, fungus, and they're going to live in this biofilm. It's like a city.
Okay.
And there's no way to break that down with just bleach. So I was going into the IAOMT paper and they were saying that 40% of root canals have a residual infection inside the tooth.
Okay.
But if you look at the work of other dentists, it can be as high as 90% of root canals have a residual infection. And this shows up to me now that we have, I thought root canals were fine. I've been doing this for a long time.
You've been practicing for what, 24 years?
Yes.
Yeah.
And I didn't have 3D imaging until 8, 9 years ago.
I think everything changed with with CBCT, 3D imaging. I've heard that from lots of other practitioners. I
Yeah.
just took our youngest to get her braces
Yeah.
progress checked, and they had just gotten their CBCT and looked at it, and he's like, "We need to continue to expand." Like I couldn't see that prior to this.
Really?
Yeah,
Yeah.
her lower teeth were still canted inward, and it's like, nope, we still need to continue to expand in order to make that work. So, by the way, I still think I owe him an email.
Oh, yeah. So the whole world opened up when we had a CBCT, and all of a sudden we saw around these root canal teeth that the bone was missing in a perfect circle
Mhm.
or an oblong, but you could see the circle getting bigger and bigger every year. You're like, this is not okay. This tooth still has something going on with
Yeah.
it. This uh, defect in the bone is getting bigger every time I look at this patient.
Yeah.
This root canal, it was done by my best root canal specialist.
Mhm.
He did such good work. Like, this isn't about like someone like failing to get a canal or failing to notice a piece of the tooth. This is like the best endodontics in the world.
Mhm.
And still, I'm seeing infection around the root of the tooth.
Yeah. Well, I mean, like how many, you know, you've given statistics about what the governing board of biological dentistry says and what other peers have said.
Yeah,
Like, how many root canals do you see that either require a second retreat or additional measures after the second retreat?
almost all of them.
Yeah. Almost all of them.
Yeah. So when I look at the CBCT, my mind blew. My mind exploded. I was like, I was so sure because my patient had no pain and no swelling
Mhm.
and no symptoms. I was sure that a root canal was the real deal.
What had been taught?
Is a real deal.
No, I mean, what had dental school, had the
Yeah.
ADA, everything.
I mean, we're taught what we know, and things take a long time to change. And what we're taught is a root canal is the end all be all.
Yeah.
There might be a retreat from time to time, but it's healthy, it's stable. All the studies were done on the absence of pain.
Yeah.
So we know in Western medicine that often things are done from a biochemical standpoint only. There's no energetics done in Western medicine anymore.
No.
Energetics were Eastern medicine. They've been discarded for a variety of reasons, which I don't want to go into. But basically, we were taught in school that once you do the root canal, everything's great. You need to put a crown on it because now the tooth is brittle as hell.
Sure. Yeah. It's
Because you
dead.
put bleach in it.
There's bleach in there. There's no blood supply.
Yeah.
We need an excessive amount of support because you basically just got like a broken glass, like a broken wine glass.
Yes.
And if it's not held together, it's just going to crumble.
Crack.
Yeah.
And that happens.
It does.
Root canal teeth will break eventually. But let's also remember that healthy Lord, healthy, like biological tissue depends on electrical signaling.
Okay.
Let's just assume that for a minute. And if you have a chronic infection, you cannot signal coherently. Remember that bleach disrupts the semiconductor and infection disrupts electrical signaling by changing the pH in the area. You know this if you're a dentist because if you have an infection, you cannot get a patient numb.
Mm-hmm.
And what does anesthetic do? It changes the pH and the voltage across the tooth.
Okay.
So if you can't get someone numb, you know that the pH is off and you know that the voltage across that tooth is off.
Okay.
So when you have a chronic infection, their electrical signaling is gone. We also know that chronic infection activates the immune system. Even if we're talking about traditional dentistry, it's 100% known that if you have a chronic infection, your immune system is activated.
Okay.
So if we know that most root canals have a chronic infection, we know if you want to pretend like you, even if you want to pretend like the physics part is BS, the molecular part stands. The studies that are tried and true stand
Sure.
that your immune system is going to get activated.
So even if you aren't into Eastern medicine, you're just
Right.
strictly Western
Western medicine, ding, there's a problem.
and that's fine. If that's you, okay.
Yeah.
I don't agree with it, but even that still is going to say there is an issue
Yep.
going on at this point.
So my goal as the practitioner is to understand the terrain. Is there a persistent infection?
Mhm.
Is there ongoing inflammation? What does the CBCT look like to me? How is my patient feeling? Are there systemic considerations that deserve consideration? Those are the questions that matter.
Mhm.
So, if the bacteria is inside the root canal, the next question is obvious, like, what do we do next?
Yeah.
So let's just assume.
I don't think there's a whole lot of options, but yeah, let's go.
And this is where I think it becomes super nuanced, where you want to pick the practitioner that to pack your parachute.
Mhm.
So, do you want a practitioner who's just going to say, well, in dental school, I was taught that once you have no pain, then everything's great? Do you want the practitioners that's like, I'm going to pull every single root canal tooth that I see? Or do you want a practitioner to pack your particular parachute that's very like sensitive to you? So if I know that you have root canals and I know that there are thousands of tubules that haven't been treated and I can see an infection on your 3D x-ray, I'm going to look at like the rest of your body to see what is going on. So I want to be very careful here.
Yeah.
Like not every root canal causes disease.
No, and I think we've spoken about this on numerous of occasions where a healthy individual can tolerate has a higher tolerance
Yeah.
than someone that is unhealthy. And it goes back to things that we've medicine is not a one magic bullet
No.
thing. So what works for me doesn't work for you, doesn't work for you, doesn't work for you. Uh, if you're healthy, maybe you can tolerate more. If you're
Right.
unhealthy, you're gonna tolerate less.
So why wouldn't we look at the whole human before we make decisions about their root canal?
Mhm.
I always talk about Robert or Becker, but there was one other thing I want to talk about with him because he linked acupuncture meridians to measurable electrical pathways.
Okay.
So, what that means is from the quantum side, individual teeth are part of a semiconductor and can act as a circuit breaker along the 12 meridians in our body.
Okay.
So, in Chinese medicine, there are 12 electrical pathways that our brain uses to help coordinate our body. And it is widely felt that teeth are like circuit breakers in the system.
Mm.
So if you have a tooth that has a metal filling or a root canal or an infection, it alters the flow of the current to that particular meridian.
It's like an interrupted loop.
It's an interrupted loop. So the teeth that are highly conductive power capacitors, they maintain the energetic balance of the system.
Hmm.
They are the gatekeepers for the system.
I feel like now we need like electrician analogies, which
We need a guy.
I know even less of.
But dental infections and root canals leave waste, which steals electrons and it drops the voltage in the circuit.
Okay.
So as the voltage drops, we get disease. And it's theorized that as voltage drops more and more and more, we can get malignancy.
Okay.
And I think that's where all this talk about like root canals and cancer comes from. And that's why we're getting oncologists asking us to remove root canal teeth. They don't understand the voltage concept,
Sure.
but they do understand that something is wrong.
I think the chronic infection is definitely something they understand, and I think as the science of root canals is getting more and more and more like research and understood, but it definitely opens up not even a discussion, but I think you're right. Every oncologist is just like, especially if they're biologic focused,
Right.
is we get at least a patient a month that's coming in now.
Yeah.
It's like remove all of my root canals. My
Yes.
oncologist has told me this is what I need to do.
So let's look at that patient.
Hmm.
What else is decreasing voltage?
Okay.
Do they only eat carbs? Guess what? Carbs decrease voltage. So I think it makes sense to look at their overall voltage before you make a recommendation.
Rather than just a broad sweeping,
Yeah,
take them all out.
take them all out.
Yeah.
If you want to look at it from a molecular biology perspective, doesn't it make sense to review their immune system and disease status before you make a decision? Isn't that what it means to be a physician? Like, I was taught by Dr. Pete Dawson, he's gone now. When he was 90 years old, he told me, "You are a physician of the masticatory system.
Mm.
You're a physician. You need to use your brain and think about, not regurgitate what you learned in dental school, but think, go back and read the work from Robert or Becker from 1982. Go back and read books from the 50s, the 40s, the 30s. See what the Germans, the Russians, the Americans wrote. Put it together by yourself. You are the physician of the patient. And don't regurgitate just what you learned in school. A lot of the studies we learned in school were petri dish based. They were done in a dark lab or a lab with artificial light.
They're also 30, 40, 50, 60, 70 years old. Technology has changed. Yeah. Well, no, I'm not saying they're no good either, but don't just rely on old research.
Right.
Continue to research, continue to question old hypotheses. Don't just, well, we proved this, what we thought we proved 80 years ago, we're done.
No.
It needs to constantly be reinforced that yes, this is continuing to be upheld, or no, we actually now are seeing a hole that we did not realize because our technology wasn't there. And that's not like a slam that you upheld, a theory or a train of thought. It was at the time.
That was the best I knew.
Exactly. With the information that we had, the information we had. But information continues to evolve.
So let's look at this from a physician standpoint of view. Like, I'm so excited. I think as physicians, there's a little bit of intuition that comes with experience, that when you look at enough x-rays and you look at enough 3D images and you look at enough patients who have cancer and you look at enough patients who have immune system problems, you can quickly pick out who's having an issue with what. That is what a good physician or dentist will do. So if we look at meridians for a few minutes and we look at the percentage of cancer patients who have an infection or a root canal with the corresponding meridian, why wouldn't you look at thousands of patients to see if that is an actual issue? And the issue I have with Western medicine is, so there was a study done that looked at root canals and they were like, let's see if that correlates to head and neck cancer.
Okay.
Great question. Missed the effing point. That's not the meridian that root canal is lying in.
The effing point?
The effing point. So they're looking to see if root canals cause head and neck cancer. Great. I think we should know that.
Sure.
But let me see the studies on root canals and the associated organs along that meridian. So every energetic meridian has a tooth and an organ or a series of organs that relate to that tooth.
Okay.
If that tooth is the circuit breaker for that organ, let's do the studies to see if patients who have cancer also have an associated root canal or infection in the tooth in the same meridian. So I've been doing that in my own practice. I'm just starting to do that, but I have thousands of patients that I can look at.
We have.
And it's pretty freaking crazy to, when you see it, you can't unsee it.
Yeah.
And we've started to notice that the patient will have an infected tooth or a root canal in a tooth, and the associated organ will have disease or cancer.
Mm-hmm.
And I want to know more. I want to be curious.
Yeah.
And I want to teach my patients to be curious as well. Meridians have also been discredited as voodoo, but
I mean, I think that's just a broader question where Western medicine dismisses Eastern medicine.
agree.
Yeah.
But can we look at some more understanding of that?
Yeah.
And I don't want patients to be like, oh, I have a root canal now. What the hell do I do? But I want those patients to think, like, first of all, don't panic.
No, I think at that point in time, it's water under the bridge. The root canal has already been
It's
done.
been done.
So don't fret over that. However, now it's your responsibility, if you care,
Yeah.
to do a little bit more digging.
And so many patients function so well with a root canal. It does not mean you have to remove it.
No, if your autoimmune system is working well,
Yeah.
it might not have any effect on you.
Is it compatible with the rest of your health?
Yeah.
So it's not a one size fits all decision. I think dentistry, biological dentistry, is about evaluating the person as a whole. So when someone comes into my office, I'm not going to be like, how many root canals have you had? Instead, I'm going to be like, how's your overall health? Are you having any inflammation or autoimmune diseases? Do you have cancer? Do you have pain, fatigue, sinus problems? What does the 3D imaging look like? I don't care if you've had 20 root canals, because there are some thought that like root canals might reduce the electrical signaling by like say 30-40%. If you've had 2 root canals and your electrical signaling is high, you're healthy, your immune system's kicking, I don't care
Yeah.
that you have those root canals.
Yeah.
For now, people change.
And I think that's a big thing is the way that I'm hearing this, the way that I'm understanding this, all root canals are sort of a for now, in the
Yeah.
sense that it's like, this is working with a caveat of for now.
Yeah, but if I see that lesion in the bone, when I look at your root canal,
Yeah.
there's a hole in your bone.
Yeah. You've got a cloudy
We've
sinus, you've got an
to get to the
infection.
bottom of
Yeah.
it. Yeah.
Um,
I'm tired of hearing that it's a scar. That's not true.
yeah.
It's just not true.
So a lot of practitioners are saying that what we see on that 3D image is a scar, and you
Yes.
see that as a infection.
I do.
Yeah.
If the root canal was done like a month ago, a year
It's a
ago,
different story.
or less, it's a different story. But the bone fills in when there's a healthy situation.
Mhm.
And if that bone doesn't fill in, there is a persistent infection in the bone.
Okay.
And I'm not going to sit by and like watch that happen without talking to my patients about it. So this isn't my decision. This is my patient's decision.
No decision is your decision, or no dentist's or no physician's decision. The decision at the end of the day it comes back on the
Right.
patient.
So if my patient comes in, they're a healthy 24-year-old, they have no autoimmune problems, no cancer, no history, they take no drugs, no medications, they feel good, they have no brain fog, they're clicking.
Mhm.
There's no abscess on their CBCT. Why would I touch them?
Yeah.
Will I tell them they have a root canal? Yes. Will I tell them to be aware of their root canal? Yes.
Yeah. I'm going to go back to that later, but yeah.
Okay. But I don't want to cause more problems for my patient by taking that tooth out and having to replace that tooth. At that point, I'm going to tell the patient, these are the things that we want to watch for.
Mhm.
These are the things that I want you to be aware of. If you want me to take it out, let's talk about that.
Mhm.
If you don't, what are we going to do to monitor that necrotic area?
Mhm.
I mean, it's a dead organ in the body.
Not just leaving it alone, not just like, well, the pain's gone, we're done.
No.
This is now a dead organ in the mouth
Yes.
or in the body. we have to continue to monitor it. We don't just wipe our hands and just
No,
say, done.
no,
Yeah.
I'm not going to do that.
Hmm.
That's wrong. And I'm going to ask my patient to keep me abreast of their, physical health and their mental health because electrical signaling also determines your mental health.
Hmm.
So I want to know how they're doing overall.
Yeah.
And I want to know if this too starts to become a problem, what they want to do about it.
Yeah.
So you can't just tell people everything's fine.
No. Well, but what if you have then, so you gave me the example of a 24-year-old
Yeah,
that's healthy, no meds,
right.
otherwise no problems. What if you get a 55-year-old? Um, maybe they don't have any active signs of disease that they're aware of, but maybe they're on three different types of medication. They're carrying around an extra 30 pounds. Their diet's not awesome.
Their
They work
redox is shot.
at Microsoft.
Yeah.
So they're inside 12 hours a
Blue light.
day. Yep. What do you say to that patient?
So that patient has a poor redox. It's very likely that their electron transport chain is compromised.
For viewers that might be coming in here for the first time, can you just go back to redox very quickly?
So if their mitochondrial health is less than optimal,
Hmm.
I want to know if this root canal is contributing to their disease state and what kind of issues are they having? What tissues are they having those issues in? What organs are being affected? And do they correlate energetically to the tooth in question?
Okay.
I'm going to pause for just a second.
Absolutely.
Okay. So we're back and we were talking about patients who might not be our healthiest patients.
Hmm.
Like they could be over 50. They work in a blue light toxic environment.
Hmm.
Circadian rhythm's not great.
Hmm.
They might have 4 or 5 medications. We want to look a little bit closer at those patients. So if they have a root canal and they are having problems with the electron transport chain in their body, then I think that's a discussion that I need to have with my patient.
Okay.
Let's first try to improve their redox or the mitochondrial function in their body.
Okay.
So,
Mitochondrial function.
yes,
Okay.
let's get them on the proper diet, the proper circadian rhythm, and see if things improve.
Hmm.
But let's not wait until we see severe disease with the associated organ before we have the discussion about their root canal.
Sure. Okay.
So I have patients who come in from their oncologist and they're like, I have this cancer and I have in the associated meridian, I have this root canal.
Hmm.
Please take it out.
Yeah.
Fine, no problem. But let's not wait to get to that point before we have the discussion with our patients
Yeah.
about their root canal tooth.
Okay. So going back to you were talking about mitochondrial health redox.
Yes.
Um, if a patient has poor circadian rhythm, poor light, that's going to affect. I'm just trying to sort of simplify this again
Yeah.
as easy as much as possible because that's my job here. If that health is poor, that natural rhythm, that natural way that the body wants to
Yeah.
behave is out of line, that's going to have a negative effect on a root canal tooth
Right.
or just the overall health of the whole body. Like that, is that what I'm hearing correctly?
The overall health of the whole body, because we aren't just biochemical beings, we are bioelectrical beings.
Okay.
We are mammals born under the condition of planet Earth. So we developed under some constants. One of the constants is UV light from the sun.
So if a patient is, again, going back to they work in a cubicle 12 hours a day,
Right.
they're only getting the light from LED bulbs, which is going to be blue light, or they're in front of their computer screen, or they're in front of their phone, or they're in front of their TV.
Yeah.
What is that blue light going to do to their body that they're not getting because they're not outside? Just,
Yeah.
to give a quick case
Absolutely.
study.
That isn't the light that we developed with as mammals.
Understand.
That's not the way our body is wired.
Mm-hmm.
We are wired to see the light from the sun. The light from the sun signals every single piece, every single informational pathway in our body is signaled by the light.
Okay.
So if you work in a cubicle, you don't see daylight, you don't see anything but blue light, you are blue light toxic, and every single signaling pathway in your body is disrupted,
Okay.
including your teeth.
Okay. So the light that they're getting is it the mitochondria?
It affects every single pathway in their body. The most basic level of energy is the mitochondria. So that's the most critical, basic level that's being affected.
Sure.
We also were born with a certain magnetic environment that has been constant or relatively constant since mankind.
Okay.
And that's the magnetic influence of planet Earth on our body. I can't wait to have our guy, our home
EMF guy.
biological guy come out and talk about it. But we developed with known constants. And when you change the constants, as we have changed them in the last 50 years, in the last 20 years, it's going to have a profound biological effect on your body.
Okay.
So,
sorry, I just wanted to go back a little.
I'm so glad you did.
Try and do a little bit of just relatability.
Yeah.
Yeah.
I totally get it. You need to go back and watch the other episodes, especially the first and second episodes, because we really hammer this point home that everything in our body has been determined by the physics of the world that we developed in. You can't pretend like humans don't obey the laws of physics.
Well, developed in or were intended to develop in.
Yeah.
So there's the world that we live in now, and then there's the world that we were evolved into.
Correct.
We were meant to be behaving this way based on just nature.
Right.
What mankind, what civilization
Right.
has created our current society to be is not what it was ever intended to be, and our bodies were never intended to function within that.
Well, and that's what's made it so hard with like the current generation of our children and our grandchildren. And we didn't develop under the blue light.
Mm-hmm.
We aren't wired to work under the blue light. We're wired to be outside. We're wired to be in the electromagnetic environment that the earth provided us. We have created a different world in the last 20 years.
Mm-hmm.
It is a different magnetic environment. It is a different light environment. And we are not adapted at this point to the environment that we have put ourselves
to
in.
thrive or even behave.
Or even be alive.
Yeah.
And we are no healthier than we were.
No, we got millions of years of
50 years
evolution,
ago.
and all of a sudden we just threw a monkey wrench into it 20 or 30 years ago and expected that evolution would just evolve in 20 or 30 years. Evolution takes hundreds of thousands, or if not millions or more of years.
If you believe in Darwinism, yes,
Yeah.
it's not going to happen overnight.
I was an anthropology major, so yes, I believe in Darwinism.
Well, we're going to vary a little bit there.
Okay.
No worries. But we don't want to think like we used to think, because we are no longer situated in an environment that we were adapted to.
Yes.
So if you ask me 10 years ago, 20 years ago, does it matter if people have metal in their mouth? I would have said, okay, well, I don't really like mercury.
Mm-hmm.
It's poisonous. So I'm not really happy about that. But otherwise, I'm okay with people having metal in their mouth. Now, in this EMF environment, I have a different feeling for metal than I did before.
Yeah.
I don't think that having an antenna in your mouth is necessarily
something that conducts.
Yeah.
Yeah.
the same as it used to be 15 years ago.
Yeah.
So we're in a whole different world now, and we have to start thinking energetically and not in a woo-woo sense. We have to really start seeing biology as both biochemistry and electrism.
Yeah.
It's not even the right word. I just made that up.
Electricity.
I'm just
Electric-doodly-doo.
I'm just trying to think of a way to make people understand that you need practitioners who see all aspects.
Yeah.
And you need to see all aspects. You can't assume that just because you've been told that this is within normal limits that it is.
Yeah.
Because I'm going to tell you right now that's not true.
Mm-hmm.
And I will firmly stand behind the fact that we have to be our own best advocates right now, because we're living in something that people don't understand.
I don't think we can.
Yeah.
The changes that have happened in the last 20 or 30 years have happened so quickly, and they've never been an environment that any organism has ever been forced to live within. There's zero research about, I mean, you can have a cell phone company that's been like, it's safe. And it's
Yeah.
like, based on what? You
Yeah.
you have no research to say that it's safe. You have nothing that's any longevity that's studied
Yeah.
generations of sustainability.
We don't have the generational studies.
Yeah.
And on top of it, there's politics and there's financial gain. And I don't think that we're going to be really getting the right information unless we really dig deep.
Hmm.
And we can go into, I don't know how root canals turned into this big political.
It's not political.
In my mind, it is.
Okay.
But you're right. Like, this discussion is not particularly
It doesn't
political.
have to be. Yeah.
But I think that we need to start taking into consideration things that we never thought about before.
Yeah.
And that maybe root canals did work in the past, and maybe some of them work now. It's a spectrum.
Sure. Yeah. I mean, if we go back in the conversation, healthy 24-year-old
Yeah.
root canals, maybe that's okay. It's a good placeholder.
It's a good placeholder. Maybe
It's holding their bite.
direction.
It's allowing them to, you don't have teeth looking for their neighbors. They're still able to chew. Teeth aren't shifting to fill holes.
My patients are shocked that when you do lose a tooth, that the tooth above it looks for its friend.
Talk about that. What
that
is
it
that?
drifts down, like the tooth above a missing tooth will start to drift down looking for its friend.
Mm-hmm.
My patients are really surprised by that.
Is that called eruption or hyper eruption?
Yeah, super eruption.
Super eruption. Thank you.
Supra eruption.
Supra eruption.
Or that if a tooth is missing, the other teeth will tilt in and the bite will collapse.
Mm-hmm.
So depending on what kind of bite you have, that can be devastating.
Yeah. So
Like-
there is a cause or a reason in a healthy individual to maybe save the tooth.
There is. Like, a class 1 bite, you can do a lot more. You can get away with a lot more missing teeth than maybe, say, a class 2 bite.
Mm-hmm.
And you and I both know, because we've seen it so many times, that a lot of class 2 bites have TMJ issues.
Mm-hmm.
And they have pain issues.
Are you a class 1 or a class 2?
2. And
same.
Yeah.
High five.
Yeah. And class 2 bites, the overbite.
Mm-hmm.
What we saw some dog, like,
oh god, that was funny.
So
yeah,
bulldogs are class 3, and then the little
bulldog was
Chihuahua with overbite is
exactly.
class 2.
I don't remember what the class 1 was, but it was boring.
Like a golden retriever.
Yeah.
So if we are those class 2 Chihuahuas with all the upper teeth showing, that is a biological adaptation from poor oxygenation, high altitude. Like, there's a lot of reasons that go into that, but it can be problematic, especially when you're missing teeth.
Mm-hmm.
So if my patient has an infected root canal and they are class 1, I'm going to have a different conversation with them than a patient who's class 2 and we're really trying to keep teeth.
Mm-hmm.
So you need a practitioner who's able to look at the big picture and explain it to the patient.
Mm-hmm.
not just a practitioner who's like, every single patient needs an implant, every single patient needs a root canal extraction. Like, you want someone who's looking at the whole picture and saying, okay, you're 70, you have a class 1 bite. Can we lose a tooth? Sure.
Mm-hmm.
You have cancer. Let's take it out. Or you're 20 years old, you have a class 1 bite, you're completely healthy. Like, let's make
Class
it
1 just being regular
normal.
occlusion.
Let's make a completely different decision for you. So you want someone who understands the nuance specifically for you.
So the importance of, if you're looking at dentists, if you have a dentist, if you're looking for a new one, occlusion-based dentistry, so that you're not ignoring a very important part of health. If you go to a lot of biologic medicine providers, not dentists even,
Right.
the first place they're going to start with is occlusion. How do your teeth come together?
Yeah.
Yeah.
So I think the bottom line is still our same story that we've been saying since we started this podcast. Every treatment decision should consider not only the tooth, but the whole person.
Mhm.
And that if you are, if you are listening because you've had a root canal, I hope this encourages patients to ask like more questions and to seek out a dentist who understands more than just like traditional or more than just biologic, that there's some other factors that they're looking at to make sure they're doing the right thing for you, and that they're able to talk to you about your individual situation, your systemic health, and they can have an honest discussion with you.
Yeah.
And I think that's what Vital Vibes is all about.
No, I'd like to go back a little bit also,
Yeah.
because I know we touched upon this, and I think we didn't do enough justice to it,
Sure.
but we've got a lot of cancer patients that come to us.
Yes.
We've got a lot of oncologists that are like, take out the root canal.
Yes.
And we talked about Eastern medicine and meridians.
Yes.
And I know we've talked about that in past podcasts as
Many
well.
times. Yeah.
Yeah, but this being the root canal specific one.
Yeah.
So if we're looking at, and I definitely want to include in the description below the podcast, but each tooth has its energetic line that
Correct.
ties. And so I'd love for you to talk a little bit more about that, because I think we sort of just glazed over that.
Well, let's go into that.
Let's go in
deep,
depth.
because I'm super excited about that.
And I think it's honestly one of the most, the most fascinating
Mhm.
things from, I if you're just listening to this for the first time, I am not a dentist. I am Dr. Kelly Fisher Coble's husband. I work in the practice, but I have had precisely 0 days of formal training, other than just being around it a whole lot.
You've been in the office for a few years now.
Informal training.
Right. Informal training.
And I'm a quick learner.
Yeah.
But from my perspective, this is the stuff that is the most fascinating to me.
Yeah.
That is the correlation that just is kind of mind blowing.
It's mind blowing if you think about it from an energetic standpoint. So there's a lot of different ways to look at this. And I think you could look at it from a chemical signaling standpoint. You could look at it from an energetic standpoint. You could look at it from like Dr. Klinghart's ART standpoint. However you look at it, there's some kind of connection between teeth and body organs.
Okay.
Now, the traditional way in acupuncture is to look at 12 major meridians traveling through the body as energy pathways.
Mm-hmm.
Personally, I see it as we were born under the sun and the magnetic field that we're under, and we receive signals from the sun that drive all the other processes in our body.
Okay.
So the light comes into our eye, and that tells our body exactly what time it is and what to do with that time. And it sends signals down these 12 pathways and drives the physiological functions of the body.
Okay.
And I believe that there are energetic hiccups. So pretend like these 12 meridians are semiconductors.
Mm-hmm.
And there is some defect in the semiconducting material along the meridians.
And we mentioned that, like, if you've got the root canal,
That could be a disruptor.
It's now a disruptor.
I
So,
also would think scars
okay.
can be an energetic disruptor. Emotional magnetic field,
Interesting. Emotional as well.
absolutely,
Really?
can be a disruptor to those pathways.
Okay.
So you can connect
So an emotional scar almost can have
the
the
same as the
same.
physical scar.
Interesting.
So if you really want to open up those pathways, you have to address the emotional scars, the physical scars, and I can't wait to have Dan from Holistic High Performance on
Yeah.
because he can talk about scars.
Yeah. Wonderful.
He is a fascia expert,
Mm-hmm.
and he can help us like discern how important scars are to that energetic pathway.
Mm-hmm.
But if we want to talk about root canals specifically,
Yes, please.
you can say that every tooth could be connected to an organ. So I have
Part of that loop.
as part of that energetic loop.
Okay.
And that root canal is a circuit breaker
Mm-hmm.
in the system, whether it breaks 100% of the circuit, 40% of the circuit, 20% of the circuit, nobody knows.
Mm-hmm.
But let's say it breaks 100% and that patient gets an associated energetic decline in the associated organ.
Mm-hmm.
So they cannot make reparative molecules.
Okay.
And that organ becomes cancerous. So I have
that loop is no
broken.
longer okay.
And I have oncologists who say, I want that root canal removed. It's tooth number 13. It's related to the lung. It's in the same circuit as the lung. My patient has lung cancer. Please remove that tooth.
Mm-hmm.
I think that's worth a discussion.
Yeah.
We see it a lot more. I wasn't taught any of this in school.
No, this isn't something that current dentistry, if you're a dental student right now, this is not something you're being taught.
No.
It was not taught 20, 30 years ago either, and it's still not being taught.
No, if you go to the IAOMT, they might talk about root canals being infectious and harmful, but they may not go into the energetics. Some do, some don't.
Mm-hmm. But your general dentistry, if you're going to,
not going to be talked about.
Not even a little bit.
Not even a little bit.
You've got to have a provider that's curious, that's looking to expand their knowledge and learn from their personal experience.
You need a provider who's willing to at least talk to you about these things.
Sure.
It's not to install fear. It's not to do treatment. It's purely to let you know that there's lots of different ways of looking at health.
No, I think it's a lot like this podcast. You know, we have the disclaimer at the beginning. This is not our advice. This is our thoughts and opinions.
Thoughts and opinions.
And whatever you, the listener, whatever you, the viewer, are hearing, look at how this applies to you or your loved ones and ask questions.
You're not a petri dish.
Yeah.
You're not an in vivo study in the dark, not in the sunlight, on the magnetic field of planet Earth. Like, you are a real electrical human being functioning in a real electrical and geomagnetic world. Biochemistry is there.
Yeah.
But you're so much more than just biochemistry. And I don't think it's fair to look at humans from one direction.
Sure.
I would never look at health as unidirectional.
Sure.
It doesn't work. We've already seen it doesn't work. Medications that cover symptoms do not work. We're seeing it now every single day. In fact, every medication causes a dramatic side effect. So I want my patients and I want myself to stay curious and keep investing the time and energy into learning more. So if these meridians are important, and I personally strongly believe from my training with Dr. Klinghardt and through the work of the, electrical medicine that's been here before, that there is a connection between all of it.
Yeah.
The molecules, the electricity, it's all important.
So this is not an advice question,
Okay.
but this is a opinion.
Sure.
You have, I won't even say it's a patient, let's say it's a family member that has a root canal on tooth 8.
Okay. Bladder, kidney.
Mm-hmm. What would be your advice for a healthy patient? Not advice, opinion.
Right.
I apologize. Opinion, tooth 8 or tooth 9
Right.
associated with those. Healthy individual versus a non-healthy individual. Like what would you think?
100%. So let's look at that patient's overall situation.
Mm-hmm.
Are they healthy, happy? Are they functioning highly? Are they feeling poorly? Like, what exactly is going on with that patient? If they told me they had bladder cancer
Mm-hmm.
and they were my family member and they had had an infection around tooth number 8, I would be pretty damn concerned that we need to get rid of that infection.
Mm-hmm.
That
And when you say get rid of that infection,
whatever it takes.
you're talking extraction though.
Possibly.
Okay.
Yeah. If it means that that tooth has to be extracted and that infection has to be cleaned out, so be it.
Mm-hmm.
Because I'd much rather have my family member healthy than have tooth number 8.
Mm-hmm.
It's a tooth. We'll figure it out.
We also do cosmetic dentistry. We know how to handle.
That's right.
Yeah.
So, I mean, it's just that important to know your patient well and know every single facet of their current situation.
Mm-hmm. And if they're healthy,
I've thought
all intents and purposes,
I've thought about it.
They're 24 years
I'm
old.
like, what if one of my kids needs a root canal
Yeah.
right now?
Mm-hmm.
I think it depends on the kid because I have 3 kids and their baselines are all considerably different. For one of my kids, I'd have no problem with them having a root canal. For one of my other kids, I'd have a big problem with them having a root canal.
Mm-hmm.
So it goes back to making medicine individual and making judgment based on the patient's current
Mm-hmm.
situation. It's not a blanket
No.
that you can just throw over your patients. And I think for many, many years in dentistry, whenever someone had a tooth infection, that everyone got the magic bullet of a root canal.
Yeah.
That was just the way
Better to
it's done.
keep the
Keep
tooth than you extract the tooth.
Yeah.
Yeah.
But you have to have these discussions with your patient. It isn't fair to blanket every single person and corral them into one solution.
No, if you've got a tooth that, say, we were just talking about tooth 8 or tooth 9, linked to, I'm sorry, what is it?
Bladder, kidney.
Thank you. They've never had a root canal, but you see an infection. Would you even recommend a root canal if they had all sorts of already sort of conditions that might be pointing towards that?
Probably not.
Yeah.
So if they're a kid, there's some great new things that have come out with kids. Kids still have the end of their root not being fully formed, and they still have cells inside of that root that can regenerate the tooth.
Mm-hmm.
So if I'm talking to a kid or a young teenager who needs a root canal, there are ways that we can do that root canal where we keep the ligament and the tooth vital.
Mm-hmm.
So we take out the necrotic pulp, but we leave some vitality to the tooth. And because they still have those cells that can regenerate, we allow the tooth to heal itself.
Okay.
And the tooth becomes vital again.
Mm.
And I think when we're talking about kids and teenagers, that's easier because they still have that wide open apex or bottom of their tooth and they still have stem cells.
Mm-hmm.
So let's rethink the way we see kids and teens. They still have stem cells. Adults don't have the same capacity.
Yeah.
So there are some studies being done where we can partially root canal adults and try to give them, you induce bleeding in the pulp chamber and you attempt to give them a scaffolding to keep that tooth vital.
Okay.
So we're getting to a point where we can keep the tooth vital, but we're not quite there yet. So at this point, if the patient had a certain kind of cancer, they needed a root canal, it was in the same meridian, I would be having a serious discussion with that patient about extracting the tooth.
Yeah. Okay.
Um,
And we don't know which is first, whether
no,
a tooth that has an infection leads to an organ
yeah,
that is on the same meridian, or does an infection in the organ lead to the infection in the tooth?
right.
The research isn't there, if I'm correct, right?
No, not even close.
Yeah,
We need studies.
sure.
We need we don't need studies in a petri dish.
Hmm.
We need real studies in a real environment. And it's hard now because everyone's environment is so different.
Hmm.
You might be living next to a cell phone tower and I might be living in the country. So how do you make those studies accurate?
Yeah.
It's very challenging. You have to start using your brain
Hmm.
and you have to start seeing everybody's baseline from what they present as. So getting that history on your patients is super important.
Yeah.
How much time do they spend outside? What kind of job do they have? Where do they live?
Hmm.
What do they do all day? Are they indoor people? Are they outdoor people? And
Do they exercise? What's their diet?
what do they exercise? What's their diet? What kind of medications do they take? You need to find a provider who will take the time to put it all together for you.
Hmm.
And then you need to be able to make some of the decisions yourself.
Absolutely.
Because assuming that physicians have all of the answers in this very complicated day and age is a mistake.
Well, I think even the best physicians in the world that care the most, they still aren't with you 24 hours a day.
No,
They don't know your home life. They don't watch what you eat. They don't
no,
see,
these
you
are
can tell them
crazy.
I work out 7 days a week,
Yeah,
but do you? So what we tell a provider, of what we tell a physician or a dentist is going
right,
to be different than reality. So you have to have some ability to analyze for yourself and like,
right.
yeah.
And like what you do at home matters so much more than what I do in the office. I can do a deep cleaning.
Hmm.
I can clean every square inch of your tooth, but if you go home and you don't clean your teeth, what I did makes no difference. So
It's like throwing a cup of water on a house fire.
it's throwing a cup of water on a house fire. And I don't know how your house was built from the day you were born,
Yeah.
but you do.
Yeah.
And you can give me a lot of clues and I can help guide people and
But we still need you to,
participate
yeah.
actively. And I also think listen to all of your options and you will intuitively have a vibe of what feels right. And if you have a dentist that you trust, they have experience. A lot of doctoring to me is experience and seeing what has happened in the past with patients who are like you. So when I see a patient, I try to think to myself, who is this like?
Mm-hmm.
What did we do? How did that work? Um, but I want to also understand that you're individual and that you aren't exactly like someone else, but I do see trends
Yeah.
and I want to apply those trends and help give you the advice that you need.
Yeah.
So my job is to guide you based on my experience and my intuition. And you can be sure that every minute that I'm not at work, I'm studying.
Nerd.
I mean, almost to the detriment of my family, but not totally because my
Yeah.
family is super important to me.
Yeah.
But I do make sure I get up with the sunrise. I spend at least an hour or two every morning researching. That's my job. I'm researching, I'm writing, I'm getting curious. And that's what I expect from my providers, that they're not just regurgitating.
Yeah.
So
And every provider is going to be different.
thanks for understanding.
Of course. Yeah. I understand the passion that you bring to this job, and I think it's
Yeah,
wonderful. I don't know that every practitioner carries that level of
I think they do.
I hope So I
Yeah.
really do.
Yeah.
And I think you can see that in just the attitude that your provider brings.
Yeah. Are they taking the time to talk to you and listen to you? Because it does take time.
And ask questions.
Yes.
Yeah.
And are you listening to them?
Hmm.
Um, whether you totally buy into what they're saying or not, it's worth listening to a really good provider's opinion.
So can I circle back a little bit then?
Let's do.
Um, Sort of talked about it. If someone already has a root canal,
Yeah.
um, regardless of whether they're healthy or they're not, what would you recommend they do?
Well, I think we already talked about that. Get it evaluated. Get a
So,
CBCT. Go to a provider who will ask you, what is your baseline?
mhm.
Are you really healthy? Or are you just not very sick?
Would you have a suggestion that maybe if they're questionable on health,
Mhm.
to also loop in their primary physician to maybe look at the associated organ?
Yes.
Hmm.
A lot of physicians will
Dismiss.
dismiss me.
Yeah.
Hmm.
Hmm.
So it's very hard to bridge the gap and hard to find physicians who are open to, looking at things differently.
Hmm.
But I have found some, and I will continue to look for more. But it's okay for the patient to say, I want a blood test on my liver.
Yeah.
I want to see those numbers. And it's not just blood work, it's like so many other,
But just getting
finding
an
a good integrative practitioner
yeah.
who does understand energetic medicine as well,
Hmm.
and then looping them in. I mean, I work with some great doctors every day who do understand the relationships that we're talking
Well,
about.
our offices correspond a lot. That
Yeah.
yeah, they are the referring doctor even.
Mm.
Um,
I mean, I have a couple patients right now who are undergoing cancer therapy. We're working with their oncologists very closely,
yeah.
and they do understand that this is an overall body health issue, and they are open to discussing different options.
So maybe that's even sort of a screening thing of if you're finding your primary provider, like, are they open
You
to,
can ask.
yeah. And if they're not, maybe that's a little bit of a red flag that they're closed off to
I think it is.
ideas.
I mean, I needed to interview a new primary care for myself, or at least I thought I did last year.
Mhm.
And I set up a phone interview for 15 minutes because I wanted to ask them, like, how do you feel about X, Y, and Z?
Mhm.
Because I wanted to know what I was getting into before I made that new patient exam with them.
Yeah.
Unfortunately, it turns out I didn't need to change providers.
Hmm.
So I was able to stay with my same provider. But while I was shopping, I was like, shopping.
These are
These are non negotiables,
no,
right?
they're important questions to
Yeah.
ask someone that's going to be, you are giving the
Mhm.
responsibility of monitoring your health.
And I want to be on the same page.
Yeah.
And I do have like a traditional Western primary care provider
Yeah.
that there are some things that Western medicine's super good at.
Hmm.
And so I see them for those things.
Yeah.
And I have an alternative energetic provider that I see for everything else. And then for a while, I had a separate third provider
Hmm.
that kind of bridged the gap between the two.
Yeah.
I'm not saying everyone needs three providers, but at the time I wasn't well,
Yeah.
and I
Based on
did,
your health,
and I did.
not yours, but
Yeah,
anyone's. Yeah.
and now I don't.
Yeah.
So what I'm trying to say is do what you need to do and find who you need to find.
And ask questions.
Yes, agreed.
Yeah.
So, I think that's all I wanted to say about root canals and whole body health. Um,
I'd like to link, I think I mentioned it, but in the description, the different teeth numbers and the
oh,
meridians that
yes, the
those link
meridians.
to. So
Hmm.
if, and I'll put a chart of tooth numbers because Western dentistry relies on the numbers of the teeth, and it's good to know that maybe
Yes.
tooth 8 here, tooth 9 here,
Yeah.
where that is in your body. If you've had a root canal there, hey, here are the associated organs that
Yeah.
might that are linked, not might, but are linked to that tooth. So if you have a root canal and you're curious, you can look and, oh, hey, here it is. So I'll try and link that down in there.
That'd be awesome.
Yeah.
I have a couple more links as well. I think people were asking me about the deuterium depleted water.
Okay.
So I wanted to set up a link for the light water.
Okay.
And we'll go from there. And then I think hopefully we can have our home, biologists come on in the next episode or two. I know we wanted to have Dan from Holistic High Performance come and talk about some of those energetic
Yeah,
pathways.
we're now a few months into the podcast, and I think it's now that we've sort of established more of a foundation, it's time to bring in guests that are specialists within their field and that we can, you know,
Yeah.
have deeper conversations on subject matters that bring in those respective disciplines.
Like-minded people.
Exactly.
Help you find your tribe.
I like that.
Very good. Until next time, I hope you stay curious, stay informed, and that you're constantly investing in your biology. Thanks for joining us.
Yeah. Thanks so much for joining.
We'll see you next
See you in a
time.
week.
Okay. Peace.